Hello and welcome to the NWR Virtual Investor Conference. Great to have your company. I'm Andrew Gagan from Ausbiz. And today we'll be hearing from Respiri. It is an e-health SaaS company supporting respiratory health management and its world-first technology detecting Weeze, which is a typical symptom of asthma. Weeze, which is Respiri's innovative technology, comprises an e-health app combined with a simple, easy-to-use handheld device. It is the first smart device to help improve asthma management by monitoring Weeze and documenting symptoms, signs, triggers, weather conditions, and medication use. And the asthma management platform also facilitates the sharing of data with caregivers, physicians, and other healthcare professionals. And a reminder, if you'd like to ask questions, do so in the Q&A session at the end of the presentation just by typing into the Q&A panel on your screen there. Well, now my pleasure to introduce Chief Executive and Managing Director of Respiri, Marjan Mikel.
Thank you, Andrew. Well, you've said it all, mate. I might just stop the presentation here, but thank you very much for that introduction. And it's pretty much spot on. And we as an organisation really have spent the last 12 months doing what it is we can do to make sure the patients get the Weeze and the app that really need it to help improve their lives. And our mission as an organisation is quite simple, and that is we want to be able to provide patients with a tool that helps them manage their asthma once they leave the care of their physician or other healthcare professional. And today there is nothing available that allows them to do that. So, and we'll get into the implications of that as we go through this presentation. And you know, our vision really is we're never going to be able to get rid of asthma as a disease state, but we can certainly minimize the challenges that asthma places on patients, the healthcare system, and their carer teams. I don't have to remind people that asthma is the third largest disease state to afflict the human race, behind cardiovascular disease and diabetes. About 340 million people have asthma across the world, sorry. And I'll focus on Australia, but even in this beautiful country of ours, 400 patients still die from asthma attacks every single year. 1 in 10 patients with asthma will be admitted into hospital or ER at least once in a 12-month period. So clearly something's not working when it comes to the management of asthma. And this is where Weeze and Respiri hope to fill the gap. As I said, one of the other issues, because of the lack of a feedback loop, is up to 2/3 of patients that think their asthma is controlled is in fact not controlled. And part of the reason is that they don't currently have anything to help them understand whether their asthma is being controlled or not. And unfortunately, the first symptom of poorly controlled asthma is an asthma attack. And the burden on the public purse is huge. In Australia alone, almost costs 25 billion US to our country every single year in lost productivity, medical interventions, hospitalizations, and other such things. So clearly there is a major issue here, and we are working towards making sure that we provide better control, not just for the patients, but for the impact it'll have on the public purse moving forward. So I introduced Weeze again, and Weeze, as was outlined previously by Andrew, is a handheld device that basically detects and, well, first of all, measures and records breathing. And our algorithm then detects the level of Weeze that the patient has with asthma. We know from clinical work that we've done that the app is at least as good as a skilled respiratory physician with a stethoscope in determining Weeze and Reeze rate. We know from what we've learned that this is pretty important, because our objective is not to replace the doctor, but as I said previously, provide the doctor, the carer team, and the patient with a tool that allows them to monitor how well their asthma is being controlled in the real world, because it's in the real world where asthma attacks happen. You don't get too many asthma attacks when you're sitting in front of your doctor in a surgery. So this is where we play. This is the service we provide. We provide continuous monitoring. We also allow for the asthma management plan that's been developed by the patient's doctor to be incorporated in the app. and in doing so, create a single repository for that patient and their asthma management plan. The information that's also captured are those factors that could lead to exacerbations, things like weather, as was discussed, pollen count, pollution, air quality, medication usage, other symptomology, etc. And what we do is build up a longitudinal picture of that patient to help them and their carer team understand what are the triggers for their asthma attacks, and in doing so, provide alerts to those patients when those trigger systems are likely to occur, and have the patient act accordingly to the asthma management plan that their doctors pull together. And importantly, the data is shared with whomever that patient wants to share that data with, their parents, doctor, pharmacist, and other carer teams. We made a lot of promises to the marketplace in 2019 when I first joined the Respiri team, not knowing what 2020 was going to throw at us. But I'm pleased to be able to say that regardless of what 2020 had in store for us, we managed to deliver on all the milestones that we committed to, on time and on budget. Most recently, we successfully raised $12.5 million in a capital raise, and this was heavily oversubscribed. We already have more than 500 pharmacies ready to stock and are stocking Weeze and ready to sell Weeze to patients. Weeze sales are accelerating as I speak, and there is a huge buzz in pharmacy in the broader community about Weeze being available for the first time for patients with asthma to better manage their asthma. We're in cahoots with Mikel and the Carlton Football Club, Women's Football Club, who are acting as our ambassadors and a huge source of PR for the organisation and also Weeze. And I'll get into a little more of those details later. We've got a whole new digital campaign in place, which I'll also shed a little more light on. We have a very important partnership with the Australian Patients Association, which is due to kick off in May. They represent the interests of 1.4 million Australians, and will be doing a campaign that will promote Weeze to the relevant patients with asthma in their group. We're looking already at broadening the portal that we're developing and the platform that we're developing to incorporate other smart devices into what the patient would be required to use to better manage their asthma, and I'll get into a little more of those details later. We are constantly upgrading our IP and have just recently submitted and had acknowledged patents for the upgraded algorithms that we've developed in 2020. And much importantly, of course, we now have a business model that works because the team here at Respiri has reduced the COGS costs of Weeze by some 85%, and we still have more to go in that area. So a lot's been achieved in 2020, and a lot's going to be achieved in 2021. As I said, in the first horizon last year, we achieved a lot of things. New management team, technology refinement, the revenue models that we adjusted to incorporate a SaaS, recurring revenue stream, a distribution agreement with our 800-pound gorilla Cipla, a global distribution agreement where they have first right refusals in other markets as well. As I mentioned, we've greatly improved the COGS for Weeze, and are now at a place where we have scalability, and we have scale available now to meet our international forecasts for Weeze sales. So we have more than enough capacity to handle what we believe we'll be selling. We did achieve CE and TGA approvals last year, and that number is incorrect. We've got agreement of 7,000 units to Cipla in the last year and Q1 this year. 2021 holds a number of challenges for us, but challenges that we're up to. Cipla has commenced and will continue to promote Weeze into the pharmacy channel, and are doing so very successfully. Pharmacies are stocking Weeze now, and the number of pharmacies that stock Weeze is also improving and increasing. Importantly, from our perspective, a critical milestone will be FDA approval, and we still expect, as I've promised, to get FDA approval before the end of this quarter. The patient experiential program is now in its fifth month, and that involves 300 patients that had Weeze introduced to their asthma management programs. and we've been monitoring those patients for a 6-month period. So the final patient out of this study will be in May this year, with data analysed by June and hopefully results available by July this year. We're also working on clinical trials to help standardise Weeze recording and make it a quantifiable parameter that doctors will measure in patients. We're in advanced discussions with quite a number of institutions in the UK at the moment, and looking forward to finalising some of those and kicking off those studies in the first half of this year. We are still on track to launch in the UK at the end of this year, and in advanced discussions with Cipla, but also other potential partners in that area. So we don't really know what COVID-19 holds in store for us for the rest of the year, and hopefully the vaccination programs that are in place across the globe will help us there. But we have contingency plans in place that are independent of the need for me or anyone here in Australia to travel. Next year is really important for us. We will continue to leverage Cipla in new markets, but we will be launching in the US and in Europe. So they are major milestones for us. And as I said, the US is very important to us, but particularly given the fact that it's one of the few markets in the world where compliance and persistence is actually reimbursed by Medicare and Medicaid, but also the HMOs in that area as well. So doctors are actually provided with an incentive to monitor how well their patients are being controlled in the real world. And we hope to cash in on some of that with regards to providing Weeze and the platforms that they'll need to be able to analyse the data. The monies that they make are around about 130 US a month, and we at this moment anticipate securing somewhere between 30 and 40 US a month per patient, per device, per doctor. So it's a big time for all of us. Everything's still in aligning around the plans that we put in place, and there's a lot to be done. As I said, we did raise in October last year, $12.5 million. It was very heavily oversubscribed. Still great support from our existing shareholders, but we also welcomed a number of institutional investors onto the share registry, which is really pleasing for us. Goes to the point that we are now an organisation that is institutional investor ready. And basically, with a bank full of money, it gives us the flexibility to do everything that we need to do. And as I said during our roadshow for the raise, the cash that we raised will bring us to a place where we will be cash positive as an organisation on the back of sales of Weeze and the SaaS program revenues. So in Australia at the moment, we're available from wholesalers, and we have had a number of pharmacies that are already stocking Weeze. Our pharmacies are onboarded by our connected care team, which are a bunch of nurses that basically help upskill them and train them on how the Weeze works, and how the system can be put in place, and how the pharmacists themselves can be part of the carer team of the patients they sell the Weeze to. We've developed a whole bunch of point of sale materials that are used in pharmacy to promote Weeze, and we are currently finalising the in-store programs where pharmacists will engage with patients that turn up to their pharmacies to purchase their asthma medications. And this is the single biggest opportunity, because every single day in Australia, in every single pharmacy, on average, 14 patients will have a discussion about their asthma with their pharmacist. That's the big opportunity. I need 1,000 pharmacists working with us, giving us one patient out of 70 a week, and we will hit our numbers for 2021. So that is the big opportunity, and we are basically doing everything we can to accelerate getting banner groups on board. And we'll be making a number of announcements around some major new agreements that are being finalised as I speak in the coming weeks. A lot of the work that we're doing online, and particularly with our ambassadors, are important to pharmacists. They like to know that the product's being supported with above-line marketing. So they are very excited about the Michael Clark and Carlton Football Club women's team activities that we're undertaking. In In May, to coincide with an International Asthma Day, the CEO from Pharmacy for Less, Mr. Thras, will be presenting on Channel 7 Sunrise and talking about Weeze. So that'll be a nice little piece of PR that we can leverage. As I said, we've put in place quite a number of large banner groups already, and we'll be pulling on a few more in the coming weeks as well. And in in April, we'll be rolling out the in-pharmacy in-store programs for patients, where pharmacists will engage with patients with asthma and explain to them the benefits of incorporating Weeze into the way they manage their asthma. That is a key program for us, and it's a program that will deliver our biggest bang for buck. I've spoken about the ambassadors, Michael Clark and the Carlton Football Club. They're generating quite a good stream of noise, both in social media and digitally. And we will be taking Michael Clark to a number of pharmacy conferences throughout the year, COVID permitting, of course, if not face-to-face, certainly in a Zoom compound. And one of the Carlton football players, Gabby, is in fact a asthmatic herself, and she's been very active on social media about how Weeze can help her with her asthma management plans as well. Digital media is not really my expertise, but the team that we've put in place here are very much revamping the website and using principles that allow us to optimize both SEO and SEM and channel more customers to our website and hopefully convert those into sales. Social media, as I said, is a critical part of what it is we're doing, and there'll be a new campaign launched in April to refresh what it is we've been doing. And not that we're going to be changing our branding, but rather just a refreshing what we're saying to people as well. And there's a whole bunch of things happening with newsletters that will be going out to established users, newsletters that will be shared with the patients from the Australian Patient Association, and other bits of information that will provide at least an area for patients to be able to explore what Weeze can do if they're not a part of this pharmacy programs, pharmacy channel, I should say. I've mentioned the Australian Patient Association. This is critical. They are a not-for-profit organisations, and we're working with them to help develop a campaign, which they've done in the past, to promote Weeze directly to their 1.4 million members. And they do have an incentive with a small payment being made to them for every patient that comes across from their membership and buys a Weeze. So, and those monies will be ploughed back into their organisation to help them with their quest to support the rights of patients across Australia. So that's pretty exciting. That'll be happening from May 2021. You heard a lot last year about the improvements in the algorithm. As I said, the algorithm now is at least as good as an experienced respiratory physician with a stethoscope in determining Weeze and identifying Weeze. And as I said, that basically provides the confidence that a doctor and a patient needs to have that what readings they're getting when they're not with their doctor are accurate and can be relied upon. Remembering, of course, that the doctor can also listen to the recording of the breathing of the patient if they choose to do so. So it's an added benefit that that our algorithm and the app provide the doctor, patients, and their carer teams. You know, it's hard to have a business if you can't manufacture a product at a reasonable rate. And as I said, the team has been remarkably successful in getting the COGS down for the Weeze device by 85%. And we anticipate that with a very clear roadmap, reducing it even further. The goal is to get to $35 US per device, which is about 50 Australian dollars, which is something that I've always had as a benchmark since I've started the organisation. So we have a plan to get there, and we're very close to it now, but we're certainly in a position where we will be hitting those COGS levels, which are in line with what other major medical device manufacturers do. The team, as I said, small team, but we are a very complementary team. Nick Smedley is our executive chairman, and myself, of course, is exec, and Tom Duthie, who's a non-executive director, and we work very well together and make decisions that we need to make in a timely manner without a cast of thousands necessary, and draw on external resources when we need them. So we're your team, and we're supported by a very experienced operational team that basically does all the work, and I take all the credit for it. But anyway, that's it from me. Thank you very much for listening to me and giving me the opportunity to update you where we're at. I'm very happy to take questions if people have any.
Marjan, thanks very much for that presentation. Let's get to the questions. We have a few that have come in, and you've spoken obviously there about looking for FDA approval, which you said will be before the end of the quarter. Can you just specify exactly, does that mean by the end of this month? That's the question.
Yes.
Okay, then what's the next step beyond that as far as your expansion plans in the US are concerned?
We're already in discussions with potential commercial partners. Although Cipla has a first right of refusals agreement with us, but that's only for the pharmacy channel. The game will be won in the US, not with pharmacy necessarily, although that will be a channel for us. The game in the US will be won with physicians, and basically the physicians that get incentivated by the CPT codes to provide the remote patient monitoring services to their patients. And I said that was about 130 US a month. Now we're in discussions with a number of organizations whose core business it is to promote those sorts of services to physicians, and also secure the necessary approvals with the various HMOs across the country to allow us to qualify for that reimbursement code. So we're in advanced discussions with those people now, and there is a strong interest in what it is we do and how it is we can augment some of the things that they're already doing. So they already have relationships with physicians, and their fundamental business model is to provide services that allows these physicians to qualify for the CPT codes. So very much very much advanced along those lines.
Yeah, that leads to the next question of, now you've already obviously touched on this as far as the cost of the device to the patient is concerned. I think you mentioned that you want to bring it down to 50 Australian dollars. Yep. Is it reimbursable in each of those markets?
In the US?
Well, it's a broad question, I guess. It's depending on which.
Okay. Yeah, I'll start with Australia. I mean, we have one of the best healthcare systems in the world without any shadow of a doubt. Unfortunately, we can't pay for everything that we get. We pay for the government or our taxes pay for the most important things. The Charter of Medicare, for instance, in Australia is either to diagnose or treat. So anything that relates to compliance is not reimbursed in Australia, and for the foreseeable future won't be. So in Australia, reimbursement is not in our plans or models for Weeze moving forward. It's all going to be out of pocket. And there are a number of other devices that's the case with. For instance, CPAP is a good example, where patients are paying up to $2,500 out of pocket to treat their sleep apnea. So we don't see that as an opportunity in Australia. In Europe, the NHS does and has got a track record of reimbursing services that provide, and tech services, SaaS platforms that provide patients with a compliance tool. So they've already done that. So there is an opportunity for the NHS to reimburse Weeze, and we're working with quite a number of people in the UK now to see how we might be able to qualify for that. The other very interesting market in Europe is Germany. Now, Germany has a track record for reimbursing devices, but not for paying for the device, but rather paying a monthly service fee to the supplier of the device to a patient. And the beauty of the German marketplace is, in many instances, it's sort of like a try before you buy. So you make, as an organization, a promise to the outcomes that you're going to provide the German government with regards to health, and they'll reimburse you for 12 months. And should you deliver on those results, they'll continue to reimburse you. If you don't, well, you lose your reimbursement. And many of the other marketplaces, the French are very generous when it comes to reimbursement as well, as are the Spanish and some of the areas in Italy as well. But the big opportunity is the US. As I said, in the US, Medicare, Medicaid, and the HMOs, they're the private health insurers that provide services in the US, recognize the need to improve compliance and keep patients out of high-cost medical environments. So remote patient monitoring is currently reimbursed in the US, and we don't have to apply for reimbursement in that because you need to be able to measure a physiological measure, which we believe we do, and we're finalising those details as I speak. But then you do need to do a roadshow and get the various players, the various HMOs to agree to, well, it's basically a rubber stamping exercise after that.
Thanks, Marjan. Just a question now in regards to sales. How are they tracking for this quarter?
Sales are tracking reasonably well, in line with what we expected. There have been a few issues around supply. I mean, there's been, and it's not just us, but there's been some issues around the supply of semiconductor materials, which has led to issues with microchip supplies as well. So that's sort of caused a couple of headaches for ourselves, but we've got all that under control at the moment. The pharmacy uptake has been positive, and I'm never happy with any of the results I get, but at least they're heading in the right direction, which is really good. And as I said, the big push for us will happen next month when we've stocked the channel with product and we introduce the in-pharmacy programs where the pharmacists will engage with patients with asthma and, I guess, upsell Weeze to those patients to better manage their asthma moving forward from a remote perspective. So next month's the big month for us from an executional perspective.
All right. I think we've pretty much come to the end of the presentation. I might just quickly ask you, Marjan, as far as support is concerned, obviously you've got like Asthma Australia, for instance. Do you have their support, and does that also flow into other markets as well as those various foundations, I guess, that are involved in it?
We have support from quite a number of university institutions. We're in discussions with Asthma Australia about how we might be able to work together. Certainly are in very advanced discussions with the National Asthma Council, which is the medical side of the equation. So we're working closely with them. And are also in very advanced discussions with the Woolcock Institution, which is part of the University of Sydney, and they specialise in respiratory medicine and sleep disorders. And are also advisors to Asthma Australia as well. So we're covering all the areas. There's a few boxes we need to tick with them to move to the next level, but understand that Asthma Australia's policy is not to endorse any single product. But we are working with them to work out how we might be able to provide a better service to patients with asthma, because that's really what matters. We're here for one reason and one reason only, and that's the patient, and all organisations need to be aligned around that.
Marjan, thanks very much. Apologies to those who asked other questions. We have simply run out of time. Marjan, Mikel, thanks so much for that presentation from Respiri.
Thank you very much, Andrew.